for the viewers or listeners, there are tiny little muscles, a tiny little muscle at the base of each pore that you have on your face. And so
I think what you see on TikTok or social media is, yes, there's some skincare place that is run by dermatologists, but
if you relax that little muscle, it causes the pore to relax too, and that helps contribute to that glassy, smooth, mirror-like skin. So
he said I have pretty good skin tone and he would not recommend any skin booster.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
welcome to the Beauty Scientist. I'm Dr. Kristy Hamilton here with my fellow board certified plastic surgeon, Dr. Roy Kim. And our topic today is a very exciting one, is South Korean skincare, the experience in the clinic, which I know has been trending all over TikTok, social media. Dr. Kim, you just got back from South Korea and you vlogged it, and I want to know everything about how it was.
Yeah, so I was fortunate. I was in Korea for about almost 2 weeks, and I asked a friend, hey, before I get there, what skincare clinic would you recommend? So I went to a skincare clinic that's run and dominated by dermatologists. It is not, I guess, a typical skincare clinic that you see on social media. So I met with a dermatologist, and the same dermatologist actually gave me all the treatments. I think what you see on TikTok or social media is, yes, there's some skincare place that is run by dermatologists, but you will meet with a patient coordinator who could be anybody, well, like literally anybody, and probably not a doctor or nurse. They'll go over treatment options for you. Then you'll meet with the dermatologist who'll confirm it or not. Then you go, if you need 2 treatments or 4 treatments, whatever, you will have that done by a doctor, but not necessarily the dermatologist that saw you, and not even necessarily done by a dermatologist. A lot of times it's done by a doctor that is moonlighting or doing this as a side gig. And so that was my personal experience getting my treatments. I had a consultation with a derm, and there you go.
So it's just like the United States, you have to know who you're going to see, because just like here, you may not be with a board certified or even a certified individual.
That's 100% correct. Yeah.
Okay. Was this like what I see online where it's like this like row of clinics like all on one street, or were you in a different part of town?
I was on a side street of that part of town. So that part of town is near Gangnam. Gangnam is a neighborhood, and it is, I mean, there's wall to wall, building after building after building of plastic surgery skincare centers. If you look up, all the signs are plastic surgery, beauty, dermatology, skincare, blah, blah, blah. So yeah, it was there.
Amazing. So you were telling me about this before we were filming, but so the first thing they do is do a thorough assessment. Is that correct? Of your skin?
Yes. Yeah.
Okay.
So I met with the dermatologist, of course. Some places, they love the technology, like you'll stick your face into a face scanner and they'll show you the massive amount of damage and ugliness that you have. And the dermatologist looked at me and did do some magnifying lens stuff and diagnosed me. And then that's when we decided on the treatments.
And what were your top concerns that you wanted to focus on, or what he wanted to focus on?
Main concerns were my age spots, also known as seborrheic keratoses for other derms out there. I also wanted better looking, more youthful skin. And finally, I wanted to ask about tighter neck skin, because my neck skin's getting loose. And so those are the 3 areas of concern. And the 4th area of concern, which was just fun, was I wanted the salmon skin DNA booster if he thought I needed it. And yes.
He didn't think you needed it?
No, he did not. He said I have pretty good skin tone, and he would not recommend any skin booster. He did recommend like glass skin or Botox facial, which is like lots of Botox injections injected just underneath the epidermis. To non-plastic surgeons, it looked like a blister, but to us, we're trying to generate a bleb. And that's what he recommended.
Okay. You're working on brown spots, skin quality and tone, neck skin tightness. And so what did that translate into in terms of your treatment regimen?
Yeah, so there are 3 main treatments. The first one we talked about, better skin quality overall, a glass skin or Botox skin or skin facial. Botox just given all over the place, not necessarily for trying to reduce wrinkles. The second thing was CO2 laser for all of my seborrheic keratoses. In other words, CO2 laser for all of my brown spots and age spots. Mm-hmm. And to tighten skin, he did not, over the chat, they recommended Thermage initially. But when he saw me and talked to me, he actually recommended Ultherapy, which is ultrasonic tightening, or it feels like heat of the SMAS layer, something that a lot of facelift surgeons don't really love in the US, but that's what he
Hmm.
recommended. And since I've never had a treatment, I figured, well, even if I'm screwing up my chances for a future facelift, one treatment is not going to generate that much scar tissue. So I said, sure.
Yeah. Yeah, and you're in good shape and you're not about to imminently have a neck lift. So this is interesting. So I think in the US we oftentimes think of Botox and then neuromodulator injections for muscle relaxation and raising brows and softening 11s and things like that. But for the viewers or listeners, there are tiny little muscles, a tiny little muscle at the base of each pore that you have on your face. And so the Botox, the purpose of injecting it all over your face and your skin is it relaxes that muscle in the pore. So when your hair sticks up on your arm, when your hairs are raised, like that's that little muscle activating it. So, but kind of by the same mechanism, if you relax that little muscle, it causes the pore to relax too, and that helps contribute to that glassy, smooth, mirror-like skin. So skin Botox sounds perfect. And then CO2 laser can be done on Asian skin. I do that too, just much more carefully than we may on Scandinavian type skin. And then Ultherapy, I think you hit the nail on the head in terms of why some of our colleagues don't like that modality. But that's a complete day. And how long what was the whole experience like? How long did it last?
Yeah, I mean, I showed up, got the consultation, paid for it, got prepped, had the treatment, and then I was out of there, and it took about 3.5 hours. Now, having said that, the consultation and payment took about, I'd say, 30 to 45 minutes. Numbing took a long time because, as you know, we have to leave not just a numbing cream on. You have to leave it on for a pretty long time to get pretty good penetration. So that, I got a facial, got photos, and then got the numbing cream. So that, I don't know, must have taken 45 minutes, possibly a little longer. And then after a long time with the numbing cream and the mask on my face, my skin was pretty numb. They then decided to give me Demerol before I started walking. So that was fun. So I had to take Demerol, which I didn't really want. They recommended it because I guess they just want people fairly snowed. And
Yeah.
I was a little out of it, but as far as I know, I didn't sleep the whole time. Then I had to walk to like a separate floor, and they brought me into the treatment room, and the same dermatologist did all the treatments all at once. And he warned me that the Ulthera would take me a long time. I didn't perceive it to take that long. He warned me it would take 45 minutes to an hour. I think honestly it took more like 30 minutes ish. And the rest of the stuff was pretty fast.
What?
And I got a facial afterwards, cooled down the area, and then.
Okay. When you walked out, you looked pretty good, pretty normal. Like, was your skin glowing at that point, or it was like too soon?
No, it was not looking good. In the US, they call them pimple patches. In Korea, they call them hydrocolloid bandages. So these are like little circles, and they're meant to like suck out the evil humors, or basically they're slightly absorbent and they help to reduce scars. Well, I mean, I must have had like 50 or 70 of those things on my face because of all the age spots and CO2 laser dots for the brown spots. And
So they were targeting, like, they were starting specific, like each brown spot, not giving you a comprehensive facial laser treatment.
That is 100% correct. So I started with, what did I start with? I started with the Ultherapy. So that felt like electricity and heat that was fairly deep. At the beginning, it didn't feel that bad, but by the end, it was pretty warm/hot. And so that was like at most maybe 4 out of 10 pain. And
Okay.
The weird after effect was that for the next 2 weeks, I would feel like electricity or tightening actually around my mandible and SMAS. So I don't think all therapy is like crap. I think it actually works. As surgeons, I don't think it works that great. But having said that, for non-surgical treatment that only takes like 45 minutes, 30 minutes, it's not bad.
Yeah, the standards are different, and if you can walk in and walk out and a couple weeks later feel tighter and lifted, then there's value in that. So, and when do you feel like your skin had fully recovered, and do you still feel like your results are evolving, or do you feel like you're pretty much there?
Yeah, I had like healing like SCARs where the CO2 laser was given like all over the place. And that took a couple days to fully go away. They recommended me placing the bandages as needed, typically once a day. So I had to replace all the bandages like 3, 4 days in a row, which was annoying because it was a lot of dots, like literally
Yeah.
60, 70, 80 little bandages on my face. I felt like there was all new skin or fairly new skin, probably in about a week or just under. And then now it's been about 2 weeks out and I look fairly normal. I would still say that you can still see the spots, but I definitely have fewer spots from the healing laser.
Very nice. It's so interesting because we hear more about like medical tourism now of Americans and other international patients going South Korea for the skincare because of the expertise and also because of cost, which we'll talk about. So this kind of feels like very akin to the men going to Turkey for the hair transplant. Can I ask like how much you paid for all of this, what you think it would have been in the United States or in your office?
Yeah, so the total was about 3,600, 700, something like that. And then actually it's about 3,600-ish for everything. And then there's a 10% tax. So it's close to 4,000 or just under it. I'd have to do the math.
Okay.
And then that's for everything. Well, you know, you and I know wholesale pricing. I don't know even at wholesale pricing for Botox, we could give a whole vial given by a dermatologist or plastic surgeon for Botox glass skin facial. I mean, I don't know about that because you also throw in, I got 1,000 pulses for the Ultherapy, which is a lot. And then I got a CO2 so the CO2 laser, he was very precise with, I don't know, maybe 80, 90, 100 age spots. I'm not joking. I had a ton of tiny spots and he took his time and that's just time, you know?
Well, it sounds great. I mean, I think all of that would be probably like one CO2 laser in the United States. And I'm sure CO2 in San Francisco is even more than that, than it is in Houston. So fun. You get to go, you get to get all these stack treatments, which I also think is a little different than what we often do here. I think in my office, you're usually coming in for maybe like Botox and filler or Botox and laser, but you're not doing usually like a facial, a laser, Botox, and tightening treatments all at once. So that's kind of an experience as well. And was it beautiful? Was it more clinical? Did you feel like you were at a spa or did you feel like you were in a more of like a traditional doctor's office?
The actual patient rooms or where I met the consultation was very nice. The place where I got the facial and was like, okay, it was nice, but it wasn't anything special. It was not that spa-like. Where I got my treatments it looked like an operating room. It looked like, or, you know, you could do local anesthesia. Of course, it's only a dermatologist's office. They don't have general anesthesia machines or anything like that. But it felt like if they got one and some monitors, they could probably do it.
Amazing. Well, I'm so excited to hear about what your experience was like because I love watching those videos and I'm always very fascinated by Korean beauty because it's so ahead of its time. So my only regret is that you didn't get the salmon sperm facial because that is just all the rage these days and we don't have it over here yet.
Yeah, I was slightly disappointed, but I did save some money. Although to be honest, the prices are way lower, especially since that specific filler, that product is made in Korea. So it's pretty inexpensive. Yeah.
Did they give any idea of when we might, I'm sure with the FDA it's going to take forever, but when we might be getting something like that over here or if they're even trying to?
I don't know. I don't know anybody at that company on a personal level, and I don't think they've applied for FDA approval. So I really have no idea.
All right. I'm going to have to join you next time you go to Korea. That's it. So I can be like Jennifer Aniston.
I am going back in November, so you're more than welcome to come with me. And the entire conference, which I'm going to, is in English. So you would understand everything. So there you go.
Perfect. Well, this was wonderful. Ask all of your South Korean beauty obsession questions in the comments and we will respond. We are the beauty scientists. Stay beautiful.
Stay beautiful. Take care.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.